investment landscape in healthcare. And actually, why don't we go down real quick, spend a couple minutes, let us know who you are and who you're with, and then we can kind of get into the questions. Is that?
Sounds good. Hi everybody, Vibhor Rastogi. I'm an investment director at Intel Capital, and I focus in on healthcare among other areas. Intel Capital, for those of you who might not be familiar with, is the corporate venture arm of Intel Corporation. Has been in business since '91, so about 21 years of investing track record. Since inception, Intel Capital has invested over $10 billion in startups around the world. Last year, we invested a little over $500 million in startups, and we are a global firm, so half of our investments happen in the US and half of our investments are outside the US. As far as healthcare, we have probably 15 or so companies in a portfolio, and they run the gamut from provider-focused companies, consumer-focused companies, as well as some biopharma and genomics, and happy to get into our investment thesis as we go along.
Hi everyone, I'm Bijan Salahizadeh. I'm a managing director at NaviMed Capital. NaviMed's a new firm investing in healthcare. We are the former healthcare groups of Carlyle, the Carlyle Group, and Highland Capital Partners. And we've come together to start a new firm, and we're investing primarily in revenue stage companies in health IT, healthcare software, and medical products. We don't do biotech. Is the thing. We don't do drugs, we like to say. I've been in healthcare for about 15 years, originally trained as a physician, and then after that worked in industry for a bunch of years, both in medtech at Medtronic and also in the original incarnation of consumer health IT/internet at a company called Health Central, which has had a few lives since then. And looking forward to the panel today.
And I'm Don Ross, and I'm managing director and co-founder of HealthTech Capital. We also don't do drugs, and we also don't do heavily regulated medical devices. We're really focused on that intersection of technology and healthcare, and define it quite broadly in terms of companies that are taking costs out of the healthcare system and that have a minimal or low FDA regulatory risk. And in this is, can be things that applications in hospital, it can be aging in place, the quantified self, even some in the consumer applications. In building the group, fundamentally, we are an angel group, but we really felt that we needed to build an entire ecosystem. When we started out on this a couple of years ago, everybody thought we should have our head examined. What is this health tech thing? And since then, we're lucky enough that it's become really quite hot. And so fundamentally, we have a foundation of angel members. Then we also have venture capital members. We also have relationships with local providers and also some industry sponsors along with that. That we felt like we had to bring everyone under the same tent. In terms of ranges, we'll do everything from a couple $100,000 to syndications, either internally or externally amongst our members, are bringing in other angel groups that could be up into the neighborhood of a couple million. We get heavily involved with companies in both mentorship, advisors, and also as board directors.
Thanks, Don. Vibhor, why don't you tell us in a little more detail, what are some of the technologies you're looking for? You said that Intel Capital in the healthcare space is investing in provider-focused companies, payer-focused, mobile health, bioinformatics, but maybe a little more detail on what you're looking for, kind of what technologies you're seeing that are interesting in Intel Capital.
Sure, happy to. So in the in the provider space, our investment thesis is there is going to be this massive shortage of physicians in the next 10 years, and I don't think that's a surprise to anybody in this room. So, how do you solve that physician shortage? You have to make what you have more productive, right? So, our investment thesis revolves around how do you deliver the same quality of care that all of us are used to, but not not have healthcare costs continue to escalate at the same rate that they have been in the past, right? So how do you do care coordination better? How did you communication and collaboration in the physicians better? How did you digitization of healthcare such that there is no duplication of care and all the errors that creep in that plague the healthcare system? So we have investments in companies such as CareCloud. That was an investment I led for Intel Capital last year. They are electronic medical records company based out of South Florida, and they also do revenue cycle management and practice management systems, and we think of them as the ERP for the ambulatory physician market, because a company like theirs would not have existed had there not been cloud computing, mobile computing, and social networking. So you're taking all these value technologies and applying them to healthcare. The second area that we focus in on is pharma, but really looking at computation needs in pharma. So we are not doing drugs either. For example, genomics, right? So we were investors in Pacific Bio. We are also looking at a number of bioinformatics companies, because everybody, I think, again around this room probably recognizes that there's going to be this tsunami of sequence data coming out of the ever-increasing lower cost of genomes. So it's already $7,000-8,000 to sequence a full human genome. It could get down to below $1,000, and so that'll create this huge data. That's everybody talks about big data, but we keep saying to people, you haven't seen anything yet. The sequence data is going to be the same scale as the data that Facebook and some of these social networks generate. There's massive storage and computational problems to be able to take that data and uncover disease patterns. So in the pharma area, that's kind of an area that we are focused on. And the third area we are focused on is the consumer. In the healthcare system, the traditional decision makers have been the physicians and the employers, but increasingly you will start to see the consumer becoming a very important stakeholder with or without the healthcare reform. So some of the things that a previous speaker talked about in terms of digital health and consumer health. So we have some companies in our portfolio such as Caring.com and Healthy Nation that are doing community as well as content for consumers, and we continue to look at devices, apps, content, and social networks around consumers as well.
Thanks, Vibhor. So what I heard you say there is you really is somewhat of a philosophy. You're looking at same or better care, but lower cost, and that's the return on an investment. So if I'm an entrepreneur out here, that's what to build value in the eyes of Intel Capital. That's kind of the value proposition.
That's correct. Yeah. So, and I think you'll hear that theme echoed throughout. Dawn touched upon it, and Bijan also touched upon it. So, how do you take cost out of the healthcare system? I think the fee for service system, we just cannot afford it. I think writings on the wall, $2 trillion in spending, accounting for all the federal deficit that we have as of today. So the cost shifting that was happening from Medicare to employer-based systems is just not going to be affordable anymore. We have to take cost out of the healthcare system, and technology would be one significant way to achieve that. So delivering care for lower cost is absolutely a fundamental part of our thesis.
Bijan, can you give us a little more detail about what you guys are looking at?
Yeah, so we're a couple things. First of all, one of the things that really colors our worldview on healthcare is that all we do is healthcare, and we're based in Washington, D.C. And we're not just based there because we enjoy the summer weather there, but we're actually based there because we think, and this is going to sound really obvious probably to this audience, but being where the regulators and the heart of health reform is a really important part of investing in a regulated industry, which healthcare is. That's a formula that's worked at lots of other firms in the past in other areas. Few have actually done that in healthcare. We think no matter what happens with the courts and the elections, there are central tenets of what's going on right now on the street, on the ground, in hospitals and insurance companies that is changing the landscape for folks like yourselves who are either starting companies or involved in new ventures or in existing ventures that are servicing them. one of the areas that I tend to like a lot is technologies, particularly on the healthcare IT side, that help providers figure out how to take on risk. That's obviously something that's happening quite significantly because of different payment models that was just touched on. One of the companies I'm involved with is in Boston. It's a company called Kyrus, Kyruus. It's a funny spelling of that word, or any word. They're an example of what we like. So what do? They help large hospital systems and insurers figure out what the physicians who are in their networks or employed by them actually do. Practice patterns, demographics, what influences practice patterns, and are really studying kind of the data analytics around physicians, which no one really ever has done before. And a lot of the variability in healthcare costs are driven by, guess what, how physicians practice medicine. And no one's ever really measured that before, and Kyrus is a commercial stage company doing that. We like that theme a lot. We like helping people who haven't measured things before measure them. And one of the maxims we talk about at NaviMed is healthcare is 30 years behind other industries. Again, not a surprise for a lot of you in the audience. We think that's a really good thing. We should all be really happy about that in this room, because that gives us the exact roadmap we need to follow, that all the other industries have followed. You look at manufacturing. You look at any other sector that's basically taken on IT and increased its productivity over the last 20 years, and there was a paper about this in the New England Journal a year ago, written by Bob Kocher, who's now at Venrock, who was in the federal government in the White House, helped draft a lot of healthcare reform. And Kocher basically studied this and said, healthcare is the only industry in the US where productivity growth has actually shrunk. Productivity has shrunk over the last 20 years, and all of the growth in the sector has been because of employment, net increase in employment. So we all have to change that formula. So we like technologies that are starting to help change that formula, and we are also pragmatists at heart at NaviMed. We tend to shy away from things that say they're going to revolutionize healthcare, because very few things can revolutionize this industry. It's hard to steer an oil tanker and do a three-point turn. You just have to kind of slowly move it, and those are the things that we're looking for when it comes to our investments.
So it's fair to say then, analytics, other tools that can help identify kind of better efficiencies and effectiveness in the system is something you guys. That's
right. We don't like taking on, for example, if we're funding a company that's selling to hospitals, we would hate to take on an EMR vendor in any way. So that's an area we won't invest in, but we will invest in all the analytics that hospitals need to make their EMRs more efficient, and how to make their providers more efficient. So, and we think there's riches and niches. There's lots of opportunity in things that are around the edges of for example, a massive multi-$100-million EMR implementation. That's a tried and true way to make money. My partners made money in a company called CareFX that was basically middleware that they invested in at Carlisle and sold last year to Harris Corp. And what they did was help inside of hospitals the 40 different disparate systems that a physician has to log into to just find out a lab value, an x-ray read, and input something into the to get an order done for a physician. They allowed that to happen on a single screen with a single sign-on. Sounds simple, but actually really hard and highly valuable, and also valuable to everyone else in that ecosystem, all the other vendors that are locked into that hospital. So those are the kinds of situations that we like to invest in, things that make hospitals more efficient.
Don, can you tell us about HealthTech?
Sure. So we're happy to be located in Silicon Valley and miss the summers in Washington. But being here in the Valley, we have deep healthcare domain expertise amongst our group, along with technology and consumer expertise. And really, some of the things that we're looking for in companies, one is that people coming out of the technology world oftentimes don't have an appreciation for the need to have a multi-part value proposition, that you're really not dealing with one customer, that you really need to address not only the patients, the consumers, you also have to have a value proposition for the physician. This flood of data that's coming in, why is the physician going to want to look at it? They don't have enough time. I had one physician put it quite succinctly to me that he said, look, I have two things I look at. Am I going to get paid and am I going to get sued? You cross those hurdles, then we can take a look at it. The other part is of course, the insurance company. How's it going to get paid or reimbursed for it? And then also, you oftentimes have to have a value proposition for the hospital or the provider also. So being able to cover those bases, and you don't have to cover them all equally depending upon your business, but boy, if you miss one, you can be sunk before you can even get out the gate. Along with that, just kind of talking a bit about there's huge opportunities in the big data, but again, data is not nearly as important as actionable information that comes out of that data, and what is it that you're going to do with it. So that really also becomes a critical piece. So kind of looking a bit of some of the companies that we've invested in and to get a bit of a flavor for it, we're investors in WellnessFX, which is a biomarker, does different biomarker measurements, both traditional and genomic, for consumers, and providing feedback for changing behaviors. Another one is PharmaSecure that deals with drug counterfeiting, particularly outside the United States, that has a SMS validation code. Another one that we just closed on a few months ago is Cadence Biomedical out of Seattle. This is a little bit more device-like. It has very low FDA requirements, but it's actually a device that helps people with neurological difficulties walk better. And it's an exciting device that's going to change people's lives for the better. And there's future tie-ins with social support networks there that'll be key. And we're currently working on a care coordination company that's in-hospital application for both coordinating care pre- and post-discharge. So perhaps that gives a bit of a feel.
So I'd like to kind of flip over now and talk about, as you're looking at these companies and working with these companies, what are some of the things that you find really derail what otherwise might be a good idea in the space? And maybe Don, we'll go back to you with the companies you're kind of mentoring.
Sure. So, as I was mentioning, is paying attention to the multiple value propositions. One thing that might be a bit different is that if you're truly going to ask the doctor to change the way that they practice medicine, that generally is a red flag. That is a very, very tough hurdle to overcome. And so it can be done, but the hurdles are a lot higher with that. And you're going to need a lot of evidence to go along with that you can actually execute on that proposition. The other big thing that people will run afoul of is understanding what the barriers are to competitors. And people coming out of the medical device industry, life science industry, really patents are the family jewels, and everything's around your patent portfolio, and that is how you really have a lock on what your part of the market is. Once you start getting into the software side of things, and that side, patents are nice, but they don't block anybody out. I mean, somebody can figure out a different way to skin the cat. So it really gets into be much more in terms of business models. It can be costs of switching. It can be due to network effects. May have to do with some data that you're generating and owning and having a business model out of that. It's really traditional models that have been tried and true in the software industry and repurposing those for the healthcare industry.
Red flags was the question. This is a panel about business models, so that's the number one thing that derails a company. And look, I've lived here in Silicon Valley for I still actually live here. I haven't moved my family yet to DC, but that's where I'm from, and I'm moving. I've lived here for 10 of the last 12 years, and one of the things I find with health tech startups, many health tech startups here, particularly those that are consumer focused in the Bay Area, is that they're not. Oftentimes, they have not figured out the value chain of how the dollars flow in healthcare prior to starting to raise capital. And where a lot of companies go wrong that are getting started in healthcare is that they haven't figured out who's actually going to pay for the service. And is it realistic to assume that they will pay? And is it realistic to assume that they will pay whatever it is per member per month, per employee per month, or whatever other model you have, or per consumer directly out of their pocket? Some have figured that out. I think they do quite well, but I think that's a huge thing that derails a lot of folks. And I think as people are getting companies started, I often think the entrepreneurs in Nashville and Atlanta who are around these big behemoth healthcare services companies and often with very entrepreneur managers who spin out and start things are sometimes closer to that. So I'd encourage folks to really get into the weeds of the business model. A second one is I really like teams that come out of healthcare, and this is to expand on a theme that was mentioned. We've all heard the pitch. I was sitting in the emergency room and then I decided to start a healthcare company. That's okay, that can be great. Just you have to pair up with someone who knows healthcare intimately. And that's not to sound pejorative or exclusionary about healthcare for those who are trying to get into it. It's just a very hard, complex ecosystem and landscape in terms of how payment and value accrue. And so it's really important, I think, to be from that ecosystem or have a senior member of your team from that ecosystem. Otherwise, you sometimes miss the huge landmines when you're getting started. Those are the most treacherous ones. The last thing I'll say is just a data point that supports that from the investor perspective. So I ran some numbers in a database that tracks kind of venture returns called Cambridge Associates. It's a group that tracks limited partners who put money in venture capital and growth equity funds. And I looked at when healthcare only or diversified firms, meaning those that do healthcare and IT, that's my mind of, well, how's this story going to end this time?
So if I can just jump in, I wanted to expand a little bit on the who pays part of your first condition there. And one of the things is don't necessarily assume that because you're going to save someone money that they're going to pay for it. We see a lot of companies coming in saying, look, I'm going to save this insurance company a ton of money, so of course they're going to pay me a per person per month basis. And I'm still waiting to see the company where the insurance company has actually paid that per person per month at an attractive rate. Historically what's happened is that in any of those sorts of conditions, the insurance company has stretched out the time. It's kind of a death by 1,000 cuts, so that by the time it actually gets implemented, the amount per person per month you're getting is so small that it's tough to run a business on it. And so I'm seeing a lot of companies that are getting into prototypes with insurance companies, but I'm still waiting to see any that actually come out and are implemented that the insurance company has actually opened their wallets on. So, you need to validate not only the cost saving side, but that they're actually going to spend money on it. It's a classic get close to the customer and understand the customer and what their motivations are.
Yeah, I think a lot has already been mentioned around the right team, understanding the healthcare market, and making sure you have a really good advisory board, etc. I think the last thing I would probably mention on what could derail companies in the health tech space is you really need to understand the usability of the software, right? So a lot of valley companies will have this super, just a very strong technology foundation, right? But, when you get it out in front of physicians, and just how busy they are and just how many patients they have to see, and they're like, I just can't use it. You couldn't give me enough money to use this technology. So we have had some companies in our portfolio that have actually done ethnographic research and have done usability testing, and we're seeing increasingly a lot of that where you embed a few people actually in the workflow of how physicians are doing their job, and then you are building their technology that actually would suit their needs. So I would think of that as a very integral part of building the technology. And the second thing I would mention is the ad-supported models that a lot of us love in the Valley, right? They are not as effective in healthcare. They might not be as effective in healthcare, right? And there's different ways of monetizing some of these without the obtrusive ads that could actually slow down a physician. So look at companies like Hippocrates that are doing some sort of an ad-supported model, but it doesn't get into the way of the physician doing their job. So, and they're a $100 million company. So there are some existing analogs that one can look at as you think about building companies.
So just for everyone's information, I've got one more question here, and then I come out and get questions from you guys. So that's the audience participation portion. So get ready because I'll call on everyone. But my last question, kind of following up on this theme of kind of the ad-based business models. With so many people kind of coming to healthcare for the first time from the tech side and not understanding, how do I get paid or what's my regulatory path and wanting to bypass all of that, I hear a lot of, well, we'll do direct to consumer on this. And I wanted to get your thoughts. Is that something that you look at, that you'd be interested in, that you've seen be successful, or what are your thoughts on kind of trying to build these direct to consumer models?
Yeah, so we definitely look at that, but consumers are becoming an important stakeholder, but let's not be confused. I mean, a consumer doesn't necessarily control the decision making or the dollars in healthcare today, right? We all hope, or we all wish we did, but we just don't, right? My healthcare is paid by Intel. I just couldn't go to Intel and say, I've just found this really cool technology, this wristband I'm going to start wearing, and can you start to cover that? And Intel's a captive, insurer, so we pay every dollar of healthcare, right? So Intel spent about $500 million in healthcare, and we just pay a small administrative fee to an insurer. And there's a lot of very large employers who are like that. So as much as we love consumer models, there are some things that have to change in how healthcare gets reimbursed. And the healthcare reform, I think, was starting to move in that direction with the healthcare insurance exchanges, and perhaps there will start to be some shift from employer-based systems to consumer-directed systems. But I think we are in the early stages of that evolution. So we look at it, but I think our investment thesis, I would say, is a lot more directed towards people that actually control the healthcare dollars, which is the biopharma companies, the insurers, and the physicians versus the consumer. Even though we have a few healthcare consumer companies in the portfolio, and you're really trying to build communities, and you are going after traditional ad-directed spending in those types of business models.
So. Let me give a slightly different take. I agree we're in early days, but I think something's changing. That's the advent of high deductible plans. When we set up our firm last year, we were shopping for plans. We said, well, gosh, a high deductible makes sense, and we're kind of healthcare guys. And we've all noticed that in our own families, it's made us change our own behavior of when we choose to go to the doctor or not. And I think it's 17 or 18% of employees now are in some version of high deductible, and maybe 7 or 8% have a deductible greater than $2,500 right now in the U.S. of people who have employer-sponsored health care. That is actually putting more control in the hands of the patient, the consumer. How they exercise that control and what business model you target them with is still kind of confusing. I think probably it's going to be best going after it through the insurer or the large employer. And there's some great companies like Castlight and others who are trying to make inroads in that area to help consumers shop for healthcare more intelligently. But in general, the direct-to-consumer model has been very challenging. I think it's funny because it works when we all pay for our gym memberships every month. And it works for these, a number of kind of what I call like wellness companies online. Like a great example is a company called Lumos in San Francisco that I'm not an investor in, but I wish I was, because it's on fire and growing dramatically, and people spend $89 to $100 a year to take brain fitness tests and compare their brain fitness to their friends. A lot of elderly sign up to do this, and is that healthcare or not? I don't know, but people are willing to pay for it. And so I think the place where a lot of healthcare entrepreneurs stumble when it comes to direct to healthcare, and a lot of investors have stumbled, is that we all assume that because we in this room use smartphones and the penetration amongst this demographic is so high that the people who actually need it have the same penetration usage, and they don't. When you look at the usage of smartphones amongst people over the age of 65 or 85, particularly those with a chronic disease or 2 or 3, it's way low, like 10%, 15% range at most. It's growing, but it's way low. So to assume that people are going to use smartphones and pay for apps, the people who need those apps for the management of their health care, not their wellness, I think is a questionable assumption, and probably will be until folks like us are in that demographic.
So clearly the landscape is shifting towards more patient empowerment, and both between the deductibles, the moves out of Washington, And certainly, I mean, there's a long history in the scientific data that when patients take control over their own health, they're actually healthier than if they rely on doctors to be in charge of their health. So that's a direction that it's going, you know, whether glacially or rapidly, but it's definitely headed in that direction. You know, that said, I think the points are spot on there. The really, in the direct-to-consumer, there's, you know, I think there's going to probably be, you know, some apps that will be just, you know, will be a big hit in the wellness front, somewhat of just the law of numbers. Somebody's going to hit something that's really going to take off. We're really a lot more interested in businesses and really as the consumer, as I was talking about earlier in the multi-part value proposition. It's very rare that you have a value proposition that's just directly to the consumer and disintermediates the rest of the healthcare system. That's very unlikely to have success. The one area that I think that there is some real potential with the direct-to-consumer as you start looking at the challenges of accessing and coordinating some of the big data. And then you start looking at and some of the HIPAA compliance regulations and other regulatory factors in there. But then you start looking at where consumers actually freely share their data in patients like me. Somewhat of the 23andMe, and so where you're working outside of the HIPAA compliance, I think there's really that's some of the low-hanging fruit and some of the early data analysis in connecting large populations and behaviors and what's going on in a person's individual health. I'd make just in a tiny wrap-up on it. Perhaps a direct-to-consumer is to come back to PharmaSecure. What that company does is that they're right in the production line, ex-US, instead of getting your pills in bottles, they're bubble packed for your dosage. And so fractions of a penny, they print a unique SMS code on every bubble pack that goes through the manufacturer. And so then when it comes out, and in other countries you can have counterfeiting that goes on in the entire supply chain, even by the local pharmacist. So there's not a trust that you're actually getting the correct drug. In this case, you get the drug, you look on it, you type in your SMS code, you get a validation code back as to whether or not that drug is a true drug. And for the very, very first time, there's going to be the ability to connect the pharmaceutical companies directly to the people that are using their drugs. And that has some really exciting possibilities to it.
Great. All right, who's got my first question? Anyone? Good.
Hi, you guys had mentioned that the people who are moving out of technology into healthcare without a lot of partnership are less likely to succeed. Do you know of groups, associations besides this forum, we already know this forum over here, where people can learn and affiliate about this industry for technology people?
Well, you know, sir, I mean, SVForum is certainly good. There's, you know, Rock Health is doing a lot of work, although they tend to be a little more on the consumer side rather than the hardcore healthcare side.
I would recommend HIMSS, right? So that's like the largest industry conference that happens, you know, usually in Jan or Feb. Was in Vegas earlier this year. So I think I've found it to be by far the best networking source if you're just looking to network with technologists in healthcare.
One on this side? Great.
Hi, I heard you talk a lot about the value proposition being changing the business of healthcare, not so much about actually changing health. How important is it that technologies improve health?
It's a good question. I think it's really important, and you're right. We kind of, didn't talk about it on this panel. We were talking. A couple of us were talking before. The dispersion of new innovation that's valuable in the area of actually changing health is actually easier than the dispersion of technologies that change the business of health, because there are infrastructures like detailing and sales forces and everything else that roll out new drugs and new devices, and there isn't that in what a lot of the people in here are interested in, which is new business models and the management of health. I think it's critical. As I think about the cost and quality, And the quality has to be the same or better, and the cost has to be lower in terms of a big framework that lots of people are talking about these days. So absolutely the improvement of health is critical, if that's kind of where you were going with the question. What I don't think payers are going to pay for anymore, and there's folks from Medicare here today, or as readily, is incrementalism. Incremental increases in outcomes, I think, are going to be really hard to pay for. And certainly no increases in outcomes or other measures are going to be impossible. So I think that remains important. So you got to go back to think about the triple aim that Berwick laid down when he started to run Medicare.
So I would say, or jump in, there's just part of the reasons for the focus is that there's a lot of tried and true strategies for improving health that probably all of us know about them in the room. From an investment standpoint, the challenge is how are you going to be able to implement that so that we can make money at it? And so yes, improving health is the bottom line and the end result, but that hasn't been the really sort of the immediate challenge from a business investment perspective rather than a public policy perspective.
But there are areas like genomics, which is an area we are, for example, looking at, as I talked about computational genomics, right? So, I mean, that is going to fundamentally change how medicine is how drugs are developed and how drugs are administered, right? And there's a lot of innovation happening in the Valley, both on the sequencing side as well as looking at the data coming out of the sequencers, that I think will also change how healthcare is practiced and delivered.
This is a business model kind of question. Given that there won't be enough doctors to go around, and given the increase of people moving to high deductible plans, do you see any models emerging where doctors might be able to charge incremental fees, if you will, for either offering telehealth services or maybe monitoring services, where consumers might be willing to pay that directly because it might be a little less than going into the doctor and waiting 3 weeks? Are you seeing anything like that in the market?
Real quick, I actually look up MD Revolution online. So it's kind of a concierge service that does a lot of telehealth stuff online and integrates that into practice. But have you guys seen anything in that area?
So certainly, as you alluded to in the telehealth area, so to take the doctor resources and to be able to deploy them more efficiently. I think there's a lot going on in that area. There's issues of reimbursements and getting paid. That's getting better, and also practicing across state lines, and all of that is getting resolved. I think there is also, certainly for some specialties, in terms of like the concierge medicine, of having more of a direct pay model with patients, and that already exists a lot with child psychiatry as an example, where that often happens now. So, whether that would scale through the system to, primary care physicians, I'm a bit more skeptical of. I think it's probably going to be more in tools are going to leverage the doctor's time rather than so much a direct pay from the consumer.
I guess the only other thing I would add to that is, Intel has probably for the last 6 or 7 years been really trying to move the needle on telemedicine. So, and really around elderly patients, right? So how do you do aging in place, and how do you help physicians take care and caregivers, and as well as family take care of the elderly patients. So Intel was one of the founding members of the Continua Alliance, which drove standards around telemedicine, and as Don alluded to, I think reimbursement as well as the fact that you can practice across state lines tend to be the biggest barriers. And there was a bill moving through Congress. I'm not sure of the status of that particular legislation, which was towards can you actually as a physician in Alabama see a patient in New York, and it's obviously much cheaper to practice in Alabama than it is to practice in New York. So that's one very good way to drive down different costs. And the other last thing I would add to that is we're seeing a lot more global adoption around telemedicine. So, for example, a company approached us from India that was starting to do a Starbucks-type rollout of telemedicine franchise centers in India, and they were looking to raise capital. They were already backed by some fairly big healthcare organizations in India. So I think in some of the emerging markets where there is not just as much regulation, we'll see a lot more innovation happening around these new areas like telemedicine.
You guys gave us a warning about trying to change doctors' behavior, which is very well heated. But the doctor-patient relationship on the other side, that accounts for a fairly large chunk of what healthcare is about. So I was wondering if you had any success stories outside of government incentives and regulations, somebody that's managed to really change behavior.
Don't go there.
Well, there have been a few companies in the Valley that have that were funded. There was one in particular that was funded last year, Zorg Dogs. That's I wouldn't say it's changing how care is delivered, but it's still on the periphery of, how do physicians see patients, right? So what they do is, if you're a physician and you have certain open slots on your calendar, they make that available via an API to patients. So, if you're looking for a dentist in San Francisco in the next 30 minutes, you can go in and do a search, and they'll show you who's available, as well as maybe give you some quality information about that as well. And some early indicators are that physicians have started to adopt it, whereby it's a win-win for physicians as well as for consumers. So that's still I wouldn't say it's fundamentally changing how medicine is practiced, but that's one example of we've heard physicians were initially very reluctant and are gradually warming up to that idea. So
I think the things that change, that's a good answer. I think the things that have changed the physician-patient relationship have not maybe been in the framework that we might think they are. And instead, I'm thinking of, in states, for example, California is not one of those states right now, at least Northern California. In states where there are minute clinics, you guys probably know what that is. CVS bought this chain of in-store clinics. In states where there are minute clinics, primary care docs are much more apt to have longer hours where they see patients, open on Saturdays for their practice, open later into the evening. And so those are the things that are subtle that I think change how physicians and patients interact with physician offices. ZocDocs may be another example of that. They're often driven by some slightly outside innovation that threatens the physician in some way, or makes them realize that, I can't do what I did. I have to change what I did. The other one I kind of like, and I think the jury's out on, is companies like Jif here in Palo Alto, who are saying, look, the unit of prescription we're going to give our patient is an app or a piece of information that's branded by the doctor and tells them how to manage their chronic care or chronic disease. As I said before, I think that's going to work better for younger patients, particularly those with like diabetes or younger patients with chronic diseases that younger patients tend to have. But I think there are people trying to change that. I just think, like everything else we've talked about, it's just a little more plodding in healthcare. That fundamental physician encounter hasn't changed in a long, long time, right?
We've got one more question. I know I'm missing a couple, but I'm sure.
Okay, I'm going to cheat then. It's a two-part question.
Two more.
First, and I'm sorry, I keep asking these challenging things, but this is to you guys as investors. I've been getting a startup going for the last few years. We've got a great product as judged by doctors, nurses, and patients. We've got a lot of good things going for us. We're well along the way. We don't have a lot of customers. So my first question is there a need, because we've been finding among investors to whom we've talked practically uniformly, we already have to be in business before we can get funded to get into business. That's a fact, okay? The second question is even more challenging. This is the harder one. Who are we supposed to believe? I like, for example, Mr. Ross's point about the multi-part value proposition, but I want to promise you that it's a major investment firms, we've been hammered for having a multi-part value proposition. There are experts that could come up here Maybe they're not as expert as you. Yeah, I really enjoyed this, but there are people that come up here, could come up here and would contradict most of the main points you guys have made and would be representatives of the investment community.
That's the definition of an expert, isn't it?
How do you help, what can you tell to help a poor erstwhile startup guy like me find his way through this minefield of confusing advice?
Well, let me validate one thing you're saying, and then I'll let the other guys jump in. I think there's a huge funding gap between in health tech that there isn't in like consumer internet and lots of other spaces that are prevalent here in the Valley. There is not a very broad angel network. I mean, these guys are trying to fix that, which I really applaud them for, because there's this massive gap between people with great ideas and great kind of early validation, but not ready for Series A financing, because the Series A is, looks later and later in a lot of these healthcare companies these days. I don't know how that gets filled, but part of the way that gets filled is that there has to be an ecosystem of successful entrepreneurs who are then taking the winnings from their prior success and investing it back into younger companies. And we don't quite have that yet. Like Esther Dyson does a lot of angel investing, and the list starts to run pretty low right now. There isn't like a big ecosystem of Ron Conways and 15 other versions of Ron who do companies at a really interesting idea stage, but prior to kind of having, 500,000 of revenue or whatever the metric is. I don't know how to fix that, but I think it's a huge issue. I think Rock Health and some of these other things are trying to fix it because they're trying to create these ecosystem networks, and I hope that works. I want it to.
We could have a whole other session on the spray and pray philosophy of early stage investing, which is not one that I subscribe to. But I think, without knowing your particular situation, it certainly is true that both as organized angel groups and venture capitalists have somewhat moved up the scale. It is a risk-reward evaluation. And certainly today, partly the expectation of getting further down the road does have to do with the fact that oftentimes it requires less money because you don't have big infrastructure investments as you would or have had 10 and 20 years ago. That said, oftentimes there will be companies where we'll make suggestions of perhaps some alternative grant funding to get to a particular place. And again, I'm guessing because I don't know your particular situation, but embedded in that multi-part value proposition is making it really, really clear that there is an understanding of who the customer is that's actually paying the dollars, and having validation that they are in fact going to pay. And I've seen that that's come out through sometimes paid pilot studies, or where there's been a grant for a pilot study if it's something, say, going into a hospital. I don't know if that helps you at all. But
can I give I know we're running late. Can I just give a cynical answer? So the cynical answer is that healthcare doesn't have 100x returns. And why there's an ecosystem outside of healthcare, like consumer internet, to back fairly early stage ideas that are unvalidated is because this is the week where Facebook will go public and Excel's holding will be 900x their initial investment. And Zynga Series A is valued at 90x today, and Instagram, I wait for every healthcare panel for the word Instagram, the I word, to come up. Instagram 50x. And healthcare is a market. I did a study on this. We published it in Nature last year. Healthcare returns in venture have been better than tech returns over the last decade. That's a surprise to most people. Except at the very upper end, the top 1% of returns, healthcare never has these. Healthcare has the slow and steady 2 to 4x. That's what it's known for. So I think when the angels putting money in consumer tech, they're saying, I want 1,000x, because that's spray and pray, right? Not you guys, but others. And you don't get that in healthcare. So it's inherently less sexy. And again, I don't know how to fix that, but we got to trumpet the fact that we're actually creating value for the healthcare system, and the returns are better.
All right. How about a round of applause?